I'm your host, Hillary Bricken, and this is the Cannabis Law Now podcast, where we regularly discuss issues related to the cannabis industry, including investment, day-to-day operational issues, and potential reform on the horizon that will impact all cannabis businesses and investors in the United States. On today's episode of the Cannabis Law Now podcast, I am very lucky to have with me the EVP of Legal Affairs at multi-state operator Jushi, Matt Leeth. Matt, thanks. Welcome to the show.
Thanks for having me.
Of course. I don't know how many years ago now, but multi-state operator used to be a fairly scary term in the industry because it really, in some people's minds, represented kind of large marijuana, big marijuana. What's it like being general counsel to a multi-state operator this day and age at a company like Jushi?
Well, I had started my cannabis career as a lawyer, so to speak, at the Green Solution in Colorado, where we were just focused in Colorado there. We had some side actions, some national plays going on, but predominantly was not a multi-state operator, it was a single state operator there, but a large one. At Jushi, I would say, it started out as an infusion of capital from investors looking to invest in good assets, operating assets in the U.S. I would say what it's like working at Jushi has probably gone through iterations over the last, give or take, 6 years. And it really started out as, making prudent, shrewd investment decisions based off of good financials and forward-looking, outlooks on how those market conditions will change. But, as time has gone on, I would say, working in a legal capacity, legal compliance at Jushi as a multi-state operator really just means my head is filled with multiple states of regulations and relationships with regulators and trials and tribulations of, operating a national company that is, predominantly siloed state to state. So just as the business at Jushi, as well as at other multiple, companies, multi-state operators has evolved, it's about scaling businesses without the, benefit of multi-state interconnection. So it's definitely challenging. It doesn't really scale intellectually in the same way that a lot of other, traditional companies do. However, it's certainly been lots of opportunity at every turn when we're looking to launch things on a national basis.
I know you've been in the game for a while. I have too. And prior to 2013, when we got the first Cole memo, it was dicey, I think, in many states, with the lone exception probably of Colorado, which was already highly regulated, I think, as of 2010. What now does your typical day look like as a general counsel at Jushi? You concerned about the federal government in any capacity anymore?
I certainly am, mainly from the perspective of, what's coming next, and I'm sure we'll still talk a little bit about that shortly, but I would say I'm definitely more battle hardened through the years. I'm sure you are as well, counseling clients through the Cole memo, the rescission of the Cole memo, and kind of where we stand today of sort of testimony about, adhering to the principles of the Cole memo, but the Cole memo not really existing like it once did. I would say when I jumped in the industry in 2016, I came from a pretty traditional telecom industry background. So I really went from a highly regulated and matured industry to a very entrepreneurial, challenging industry with regulators at a state level, many of whom have never regulated businesses before, and depending on the state, could come from backgrounds skewing more towards law enforcement or taxation or pharmacy, and seeing the philosophies kind of translate into those industries, from those industries into cannabis has created a lot of, opportunity and sometimes roadblocks. But at a federal level, I think the biggest concern that we all sort of have, but no one can really quantify yet, is, how the federal government will treat marijuana, when it's Schedule 3 and, potentially descheduled entirely in the future. So it's in many ways anyone's guess there. And while I would hope that by the time these changes at a federal level are proposed, the industry has already been so entrenched in the way things are done in certain states, but I do hope there'll be a dialogue with the federal government on, how to best regulate the industry. But, it's anyone's guess.
And Jushi, like most of our multi-state operators in the U.S., is a publicly traded company. I still think you have people scratching their heads over how a company can go public when it's technically illegally trafficking in a controlled substance. Was the go public process difficult for Jushi?
Yes, it was. And I'm sure it was difficult for every MSO that has gone public. In Jushi's story, It was a little late to the game in terms of formation. It was formed in early 2018 by four key founders with varying backgrounds themselves, but all of whom had been involved directly or indirectly in the cannabis industry for years prior to that. And for Jushi's future, it was paramount that it went public, pretty much as quickly as it reasonably could. And in 2019, that was a very chaotic year. We went public in June of 2019. On the NEO exchange, which has now been, I believe, renamed since then. But when it went public, went through a reverse merger structure up in Canada, which was pretty much the playbook for cannabis companies to go public. And that, just like with SPACs in the US, that rose to prominence because you have these sort of shell publicly traded companies that could fast track incoming companies like Jushi to go public faster and economically, which it just really was key to opening up the capital markets for the ability to expand, not just necessarily horizontally across multiple states, but in Jushi's case, to really invest on going vertical as much as it reasonably could in certain key markets. So I think Jushi's success to date, or at least its footprint, is really thanks in part to going public when it did. In 2019, you had sort of a bust toward the end of the year in the cannabis market as sort of the, I believe, 2018 Canada adult use sort of induced fervor was starting to dissipate. So I would speculate if we didn't go public as fast as we did, we may have been crowded out of the opportunity for at least a couple of years until 21 or so when it heated back up. But long story short, it was a very hectic time for the lawyers, the financial folks, and the leadership at Jushi going public.
And you had mentioned intellectual scaling, right? These businesses can't scale like your traditional business because of the lack, frankly, of interstate commerce, given the federal illegality of cannabis. Truly hindering, obviously. It has multiple collateral effects regarding product integrity, the ability to expand, the ability to organize and have oversight. What is it like operating as an MSO, given the current legal landscape?
It's really about trying to find efficiencies of scale when you can't have physical efficiencies created. You've got scenarios where we may have a very hot selling category in one state that we legally cannot produce in another. We've got nomenclatures or strain names that we can use in some markets and not others, things like that, which can really cause patient confusion. But then really, that I would say that's more the front of the house things that everyone could see. The back of the house, like the standard operating procedures and the national programs. I mean, Jushi has, national sanitation programs, cultivation programs, processing programs, retail etiquettes, and SOPs. What we do is we nationalize those programs as much as we can, but then we'll have to have addendums or similar concepts on a state-by-state basis, because even if we can produce the same products in one state or another, we may not be able to grow in the same process and procedure in one state that we can in another. So I would say, a lot of those operational challenges translates into compliance and legal questions that need to be solved, which I'm thankful at this point in Jushi's maturity, we're there, but that wasn't by luck. That was a lot of effort. And that wasn't just the lawyers or compliance team folks. It was a lot of operational know-how. So, the intellectual scaling is just very difficult because you can't just come up with, a GMP-based process and procedure and then just roll it out. And that's putting aside the fact that in most states we operate in, if you change one word in an SOP, you may have to submit that to a regulator and wait for them to okay it. So, coming up with the plans is challenging, rolling them out is challenging, and in some cases, rolling them out on time can be very challenging.
In the states, this is truly a patchwork quilt of state-by-state laws and regulations. No two are the same. I still maintain the personal opinion that there's no gold standard out there. For some reason, states keep copying and pumping out maybe even the worst from each other, depending on the program. Much to my chagrin, I would hope that they'd learn from each other and build up and make better. In your opinion, what's the best state that's been had for Jushi now?
I will tell you the best state right now is frankly, and this is strictly from the sentiment of having a regulator that is proactively listening to the industry and not to be told what to do, of course, how to regulate the industry, but to listen to stakeholders that have been operating for years and sometimes, years outside of the state that I'm speaking of. But in Virginia, we recently regulatory oversight recently transferred from the Board of Pharmacy, which itself was a fairly fair regulator, but had a lot of pharmacological background that it itself brought into the industry. Recently, that transferred over to the CCA, Cannabis Control Authority, and that leadership, from everything I've heard, has been very receptive to, not just taking regulations that are on the books and accepting them as gospel, but rather, willing to listen to the industry to say why this may not work or why this could be refined in a different way. And I look at all those conversations not like, steps backwards in any way for, consumer health and safety, but rather, trying to help this industry continue to grow, because it has been a very challenging industry. And in certain states, Virginia is not necessarily one of them. We have had just difficulties with efficiencies strictly due to, operational burdens brought on by regulation. So I really, still have a very good sentiment and feeling towards the CCA and their leadership. I've heard great things, haven't really had to deal with them too directly yet, but Ohio, the transfer to all the control to Division of Cannabis Control there, their leadership, I'm told, comes from a, liquor regulatory background with sort of that same mindset, whether you look at it as a medicine or, an intoxicant or both, the role of the regulators is to ensure consumer and patient safety while letting the businesses run their businesses. And I think that's sort of the sentiment I'm getting from Ohio. Those are my top two right now that Jushi's dealing with.
And on the flip, what have been the toughest states? And you may be surprising people here on what the toughest states have been. And, what do I mean when I say tough versus best? You hit the nail on the head from the regulatory perspective, with an eye to consumer safety, eye to public health and safety, but also being business intuitive, friendly, investing in innovation. From that perspective, what have the toughest states been? Maybe one or two, if you don't mind.
So I'm not sure that I would necessarily tell you who states I dislike currently, especially ones that Jushi is currently operating within. But I would say philosophically, a lot of the things I was saying earlier about what makes a quote unquote good state to operate in or communicate with, it's really the opposite of that. One of the most frustrating things I think in operating in a state would be knowing there's a rule on the books that makes no sense from a patient health and safety perspective, or truth in advertising perspective, or it's just otherwise draconian without really much, rationale for it being so, and having a regulator that's not receptive to listening and potentially, of course, going through a formal rulemaking process to address. So I will say historically, Nevada was a very tough state for Jushi, primarily from a entrance perspective. They had a lot of, we'll just say, political drama and baggage that had developed in 2018, 2019 under the Department of Taxation, and then that transferred to the CCB. But that wasn't an overnight switch. That created a audaciously long backlog for any changes of ownership applications or anything else that ultimately became the regulatory approval factor for us to be able to operate within those states. And when you're in an industry that, once you've made the investment decision and you've tied up the capital to enter a state, every day you're not actually closing that transaction is a lost opportunity. So that was a very challenging state. There were some, interesting ways to help expedite the process here and there in Nevada. We got through those processes, had everything approved, of course, before we stepped into these licenses. But at the end of the day, substantively, having a regulator that listens to you and is willing to change the way things are done for the good of the industry and for patients and consumers, substantively is very important. But procedurally, too, having regulators that respond quickly to applications of any sort is critical. So while I won't name, currently states that, I dislike dealing with on a daily basis, I would say if you're a state regulator listening to this and you respond to applications quickly and, take a phone call from the industry, then you're not one of those states.
I like that criteria. Okay. Now, other question, and I think a lot of people do want to know this from the MSO perspective, because we don't have interstate commerce. Potentially, Jushi has to set up a new entity with new licensing every time it enters a state, or it's in these third-party relationships to expand the footprint, whether that's IP licensing, management companies, whatever, could span the gamut. How are you dealing with what I'm going to call the banking epidemic? And for everybody listening, whether you're a seasoned cannabis operator or a newbie, obviously access to financial institutions is very difficult because of federal illegality. We really, when I say we, the industry, only only have one path to legitimate banking through the Financial Crimes Enforcement Network guidelines from 2014 that enable financial institutions to just bank the industry. I'm not even talking about lending or anything else, that are still around that did not get rescinded in 2018. So how do you deal with that? And especially as legal counsel, I know it's no picnic. I represent a few banks, and just dealing with their compliance and reporting to their regulators. This is a heavy lift with which to comply those guidelines.
Yeah, it's something that I'm sad to say that 6 years, actually 8 years into the industry, there hasn't been much material change, how cannabis companies bank. I would say MSOs typically have, I guess, the privilege, I think, of working with more banks that are willing, based on their own risk prospectus and their tolerances, which cannabis companies they would work with. I think we probably have more opportunities than a brand new upstart that's not well funded or well capitalized. However, it's still very challenging. I don't know what the total count is currently as of today, but we have many banking relationships and dozens of banking accounts across the U.S. I would say cannabis dispensaries are still very much so a cash-driven business. Of course, there has been at one point credit card transactions that pretty much got shut down quickly 5-6 years ago by Visa, MasterCard, and has never really come back. There has been most recently point of banking terminals, or in some cases debit terminals. Those have had their own trials and tribulations. They're fairly expensive. I think when you go to any other retail store and use your debit card, you're not being charged as a consumer anything for the ability to do that. But in almost every dispensary you walk into, many of Jushi's included, there is a $3 or $3.50 convenience fee, and that's typically not a profit center for the cannabis companies. That's just basically a mitigation of the cost it costs those companies to take that charges. And that's generally because when you have rules and procedures in banking rules that crowd out all the federally chartered banks, and you're only dealing with state chartered banks, and you're only dealing with sort of a subset of payment processing vendors, everything gets more expensive. And then as the legal and compliance side of things, you have to be very scrutinous of these opportunities. I myself have to put in the spam folder on a daily basis multiple credit card, debit card, point of banking type offerings, because everyone is sort of blasting the industry trying to get each other's business. But a lot of times you just have to really do your own KYC diligence on knowing who you're working with. It's, for a company like Jushi, we're very critical ensuring that, our transactions are coded appropriately and that we're not dealing with any sort of KYC shutdown events from merchant banks. However, it's just a sort of a black box right now still for a lot of those on the outside of those companies, those payment processing companies, to know how the inner workings work. It's high risk. That's why they call it high risk processing. And that's only because of, we don't have access to, Safe Banking Act enabled relationships with big banks. So I'm sure our CFO would love the ability to have, one main bank account at I'm not just saying anyone, but, Bank of America, some large, credible, too big to fail type bank. But, those just aren't available to the cannabis industry. And it's incredibly challenging and frankly expensive to operate in the current regime.
I too put those cannabis banking solutions, emails, and promotions into my spam folder. So you are in good company. Another question, just to pivot, because MSOs to me are still fascinating. I think they're carrying the load of a lot of progress, definitely a lot of market action. Let's talk briefly about hemp-derived intoxicating cannabinoids. And for those of you who don't know, this, at least to me, in my opinion, is a separate segment of the entire marijuana industry derived from the passage of the 2018 Farm Bill. And without getting into the excruciating details of that law, there apparently, allegedly, is a path for hemp-derived intoxicating cannabinoids that don't amount to more than 0.3% THC. And these products are taking the form of beverages, edibles, you name it, and they seem to be ubiquitous and also moving in interstate commerce. And there's a very healthy amount of debate regarding the legality, legitimacy, the origin of how these products are made. And as an MSO, Matt, and a GC for an MSO, popular one, What do you think of these products, and are they crowding your market share? Is there concern over them? What's your general sentiment?
Well, I would say, look, at the end of the day, Jushi exists for its shareholders. And if Jushi found a pathway that it felt reasonably and legally confident in the ability to enter that market, I wouldn't say that Jushi wouldn't enter it. But as it stands right now, as you sort of mitigated the way you were framing it, I think there is a lot of ambiguity here. There's a lot of gray area, and there's a lot of interpretation going on right now, which has sort of fostered this, frankly, explosion of the industry in the last 18 months or so. Jushi went public in 2018, just for example. The farm bill that is currently in effect that enabled this 0.3% THC carve out to the definition of marijuana under the Controlled Substances Act was also in 2018. But I think anyone who was reasonably close to the industry at the time knew very well that that was meant to be a non-intoxicating cannabinoid carve out, i.e. CBD, which is why you saw the CBD industry sort of unleashed almost overnight once that farm bill was passed. And then you sort of had this glut of overproduction in the CBD space, and it was determined by various people smarter than me that you could chemically convert CBD to Delta 8 THC through a fairly rudimentary process. So then you saw this influx of mildly, but still mild to moderately intoxicating products called Delta 8. And then more recently, there's a couple of different sub-interpretations to it. But the bottom line is there is now a sort of a camp or there's an industry that believes that because the hemp being grown is very low in THC, but is high in THCA, the precursor to THC, that it still fits within the confines of that exception. In the meantime, with legalization of the state-regulated marijuana industries, you've seen over time, even in states that aren't legal for adult use, like here where I'm in Florida, you can't just walk into a dispensary. You have to have a medical marijuana card that's recertified every 7 months, and a state card that's issued every year, just for the ability to buy medical marijuana, let's say with 15, 20% THCA. In the regulated industries, as I call it, maybe that's too aggressive. When you look at THC, you're looking at THC from a conversion factor, which includes THCA included in that. But because of the way the Farm Bill was crafted, there are many that believe that you do not count THCA for purposes of determining if the source product is hemp or marijuana. And if you can come to the intellectual conclusion that what you're holding in your hand is hemp, then you can extract it, you can concentrate it as much as you want, and it's still considered hemp. There's been so much law enforcement and general regulatory enforcement ambiguity over the years, it's also sort of opened up the opportunity to having very aggressive sales of these products going on. And I will say, a personal opinion, it's very frustrating having been in the state regulated side for 8 years and seen, a dozen different states up close and how they regulate their products, how, aggressively taxed and tested and frankly limited on how we can market our products, while now you've got this sort of parallel industry that has essentially no rules, subject to the FTC stepping in, that you can't blatantly copy trademarks of other food products. But other than that, there's been very little enforcement against this industry. You are seeing some states start to clamp down on this, and that's spawning its own state-based lawsuits and litigation, challenging whether states can do that when the Farm Bill arguably supersedes it. So, there's a lot of tentacles to that question. I would say the most frustrating part is, this is an industry that I live and work in that is highly taxed, highly regulated. We have always looked at ourselves like we are out there proving to the general populations that this is a safe product that can be sold, that can be marketed appropriately. It can, take a look at the Cole memo. We can do all the things that the Cole memo wants us to do or not do. And yet this is sort of an unregulated Wild West industry with the THCA intoxicating cannabinoids that's unfolding. And it's fairly enigmatic because it's not really clear, other than analyst estimates, how big the industry is getting, because these are predominantly almost exclusively privately held companies, not publicly traded companies. which, if you ask me, that's indicative of how uncertain the legal landscape is with that industry.
And at the outset of our conversation, you mentioned the potential move to Schedule 3 for cannabis, from Schedule 1 to Schedule 3. We know the Drug Enforcement Administration is reviewing the recommendations from the Department of Human Health and Safety. They're bound by the medical and scientific findings. They're going to take as long as they take to make a rule, either keeping it on Schedule 1 or moving it lower, potentially to Schedule 3. What would a reschedule to 3 mean for Jushi and potentially the other MSOs that are in this very bizarre inability to intelligently scale, somehow scaling anyway, siloed state to state? What would it mean for cannabis to become a Schedule 3 controlled substance?
Yeah, it's on its face, and I think most would agree, the biggest clear effect it would have is eliminate the IRS code 280E, which I know we're not going too deep into, but IRC 280E applies specifically to Schedule 1 and Schedule 2 drugs, disallowing business deductions and other sort of ordinary deductions that ultimately creates a scenario where MSOs are paying effective tax rates which could exceed net income. That's a huge catalyst for the industry in and of itself. How else you quantify what's to come, I think gets a lot more subject to debate. Something scheduled on Schedule 3 is not necessarily something that you can sell over the counter without a prescription, i.e., this is not going to legalize adult use on its face. There's always possibilities of sort of semi-interstate commerce opening up on the medical space and potentially on the adult use space. But it really remains to be seen how a product that is sold both recreationally and medically on Schedule 3 will exist in the interstate construct. It's to me, at least, it's really not quite clear. And until we start seeing real guidance come out, either from the DOJ or the DEA or the FDA or anyone else in between, I would say it's all just speculation. But I think the 280E solve in and of itself is worth dying on the hill over, because that is crushing the industry as it continues to mature.
I think you're right about at least what the world would look like post rescheduling. There's not a lot of scenarios where you can buy a pharmaceutical drug and then its twin recreational partner at 7-Eleven. I think you're right. There's a lot of speculation out there, but I'm with you on the 280E relief. If you could choose today, I'm just curious, as GC for Jushi, what federal regulator would you pick to oversee your business? I cannot imagine that it would be the FDA, even though they would be collateral, because obviously we're talking about potentially food and drugs. But who would you pick if you had your druthers?
When I started out, I always looked at the products like a dietary supplement. But that was a pretty naive sort of introductory viewpoint, I think, on the product, because the product can take so many different forms of ingestion, inhalation, intake. And depending on the product and how perhaps the derivatives are compounded, it can truly be a medical product or it can be a psychoactive recreational product. So I think, to your point, I think treating the entire marijuana sphere of product categories as one is problematic. But to me, I think that means that you regulate it more like an over-the-counter recreational product than you do a medical product, which to me means you probably have a TTB type oversight. I'm not saying regulate it like alcohol per se. There's not a whole lot of therapeutic or medical reasons to take alcohol, but at the same time, I think that's probably the most analogous to what I see of successful regulators at the state levels. I think if you over-regulate it like a medical product, you start getting paralysis by analysis from the regulatory bodies in terms of allowing consumers to make informed decisions about the products. Certainly, pre-market approval for cannabis products is totally inappropriate for something that's been legal or not existing for millennia. So I think, if you have a more alcohol analogous regulatory oversight at the federal level, I think that makes the most sense. Whether that's truly the TTB or a newly formed body, I don't know the answer to that. At the end of the day, though, I would hope that any federal regulator stepping into this, obviously within the confines of what the law allows them to do, I do hope they listen to the industry as they step into it and not immediately think that they know how to regulate this industry. It's just like I've seen at certain state levels. That's where it's most problematic. because this is still a very nascent industry dealing with issues operationally with OSHA, other sort of run-of-the-mill industry regulators. You see that these regulators are all stepping into this, not knowing how cannabis cultivation works or processing works. So while their oversight and regulation is important, it's also important for them to take an opportunity to listen to us and explain how things are done, where we see safety hazards, where we see patient and consumer testing concerns, things like that. Because I think we all need to have a level playing field. So we need to have a regulator that is regulating everyone, whether it's hemp or cannabis or however you want to coin the products, and treating it on an equal playing field.
Final question. And this one, back to the beginning of our conversation, MSOs, I think, used to strike fear in the heart of small cannabis businesses, craft businesses, small-time farmers, etc. Do you think MSOs are the future of regulated cannabis in the United States, or at least the most well-positioned to survive all of these macroeconomic issues that we're now seeing, the turn and whims of regulators on a state-by-state basis if the states continue? What are your thoughts on that?
I don't know how I would characterize them as the future per se. I would say that it's a necessary construct still today if you're an investor in the industry and want a diversified portfolio, because as it stands today, and frankly, even after rescheduling, it's still going to be predominantly state regulated. State market conditions are very much so in a vacuum in and of themselves. So I think it's important for investors to be able to diversify their investments with management teams they trust. That said, there are, as far as the industry on the whole, I don't think MSOs will be the only ones to survive, the next phase of this industry. There are certainly many good small operators, sometimes the quote unquote mom and pop shops. I think MSOs that have been formed to date, for the most part, of course, Jushi included, have put together, have had the ability to put together great management teams that come from other industries as well, or come from, decade or more in the cannabis industries in certain states. It's really marrying those different professional backgrounds into growing these businesses in a healthy, sort of risk-averse way. And I think regulators like when companies themselves are risk adverse, so that they're not the ones having to find these things out after the fact. So I don't know that we're the future in the sense of only MSOs will survive, but I do think that when you start looking at when more and more money starts coming into the industry, ideally through U.S. cannabis companies being able to uplist into U.S. markets, you will see investors that will want to look at that pedigree of the management teams and how long they've been operating. And that's a level of transparency I think you don't necessarily get with the small-time private operators. But again, especially in Jushi's history, when they were more on the acquisitive side of things, we've met tons of good operators, including ones we didn't acquire, that are in the industry that I think will be just fine. But, last comment I would say is you had mentioned about, surviving the, sort of the economic climate. And you're really seeing that over the last year and a half, 2 years. Anyone who could look at, stock charts, from 2021, when there was a fervor that, the new federal executive branch was going to, do this or that, which was going to open up the markets for cannabis companies, you saw a big jump in stock prices because there's a lot more certainty towards growth. And then as that certainty is kind of dwindled, subject to the more recent, Schedule 3 announcements, you've seen a real drying up, they say, of the capital markets, which I think has really affected the small-time operators the most. I would say that the mid-sized private companies, I would think, are suffering the hardest right now because it's very difficult to raise capital for larger companies, let alone smaller companies, and this level of uncertainty. So, I think MSOs, just like going back to Jushi's history of going public as quickly as it reasonably could, that was key for us to have the financial backing when the stock prices are bad, so to speak, that we're not diluting our shareholders more than we really reasonably would need to in order to withstand these issues. And we think these are all fleeting issues that we will see progress in the industry, certainly not as fast as we would like to have seen, but nonetheless, I think MSOs may survive as the time goes on more than the small operators. But I don't know that I don't know that there will be a great purge or anything and only MSOs are left standing. I think when you look at the alcohol industry, you've got macro breweries, you've got micro breweries, you've got single site brewers, you've got regional brewers. And while I don't think cannabis and alcohol is one and the same, the distribution models have kind of been created in very analogous ways, state to state. So I think you're going to see sort of that, craft cannabis versus big name cannabis sort of dichotomy grow in the industry as time goes on. But even the biggest names in cannabis aren't in most of the states are currently. So at the end of the day, there's still a huge opportunity for brand recognition that's not yet realized.
Hey, well, I appreciate that answer. And I want to thank you for coming on to the podcast, taking the time to talk with me today. And I wish Jushi the best of luck. We will definitely be watching.
Great. Thank you so much for having me.
And that concludes today's episode of the Cannabis Law Now podcast. Until next time, stay alert, stay alive.